welcome back to Retirement Dakota with Scott Tucker. I'm your host, Scott Tucker. Today we want to talk about healthcare planning. So you see here we have the common concerns we have that folks talk to us about when they're looking to retire, thinking about retirement planning for retirement, and they have healthcare concerns. They say, but Scott, I'm going to retire early. I'm under 65 years of age. I don't qualify for Medicare yet. What can I do? Well, what a lot of folks can do, now maybe you lose your job before 65 and folks are considering taking COBRA, which COBRA can be quite expensive. COBRA is keeping your employer's health insurance for 18 months but paying 102% of the premium, cost of the premium. It can really be pretty expensive. What we'd like to do when somebody needs health insurance, either because they lost their job or because they want to retire early, we want to have them talk to a health insurance broker, and we can refer you to somebody, and they can shop through all the plans and find the best coverage for the lowest price, rather than just going and getting the employer planning and paying too much. Some folks want to keep working till they're 65 when they don't need to. If you saved a good deal of money for retirement, there's no reason for you to, it may not be any reason for you to keep working just to have health insurance. That sounds like a lousy deal. Say you're 63 years old and you have $3 million saved. Do you really need to work two more years just to keep the free health insurance from the employer or the low-cost health insurance from the employer? So we might want to talk about shopping for more affordable health coverage so you can retire when you want to. Maybe you're 59, 60 years old, you want to retire now. Let's look for health insurance that could be more affordable. If you're 65 years of age or older, when you retire, we can look at Medicare. Now it's possible for your Medicare, maybe your Medicare, maybe your Part B is $174 a month. Just use some round numbers. This changes every year. But let's say we had to pay for Medicare Part B, then we might want to look at something like Medicare Advantage, where we could have a zero premium in many areas. Maybe we have a zero premium on Medicare Advantage and possibly on our drug card also, our Part D drug card. So maybe our health care, we could get it down to $174 a month in retirement if we're 65 years of age. Your mileage may vary and the Part B premium goes up every year, so we need to talk about that. If you want to talk about this, down in the description there's a link where we can get some free phone time together and go over all this. Another concern folks have is in long-term care planning. Now long-term care, I got to tell you, I'm not a great fan of long-term care insurance policies. If you already have one, I probably wouldn't get rid of it. I could go over it for you and see if it's worth keeping or considering surrendering. Long-term care insurance policies, they're a little unstable. Those companies have had quite a tough time. There's one of the carriers recently, I saw they mailed out a letter to everybody who had one of their plans, and they said that their financial strength through AM Best grades life and health insurance companies on their financial strength. This one company, I read their letter, it said they had been downgraded to a C++ credit rating. That's quite low. And so we're concerned with long-term care policies. Can they actually pay the claims? The way long-term care policies are written usually is that they can increase the premiums as you get older. They can reduce the benefits as you get older. And in some cases, they can go insolvent. They can just say, we're just going to refund your premiums with zero interest. And you maybe pay premiums for 30 years and then you get your money back zero interest. That can really not be terribly helpful. Another area where people have concerns about long-term care is, what if I run out of money and then I need long-term care and I end up in a Medicaid or state-funded nursing home? Obviously, we don't want that to happen. There are ways through financial planning to plan around this. So we can talk about ways to make this all more affordable for you or cover it better. I just don't want to put all your money in a long-term care policy. Maybe you don't ever use it. So when we talk about the under 65 market, and we don't want to spend too much time on this because I think most folks are not looking to retire before 65. Some people are. But under 65 years of age, there is no Medicare. And so there's some big companies that we've all heard of. There's a number of insurance carriers to look at there. You can possibly qualify for a subsidy on your premium through the Affordable Care Act or not. You can also, there's no, I wouldn't want to do this, but there's no penalty now for not having the Affordable Care Act plans. So you can have other health insurance plans that maybe are more affordable. You can also consider something like a Christian Medicare. A lot of different ways you can go with that. When we talk about Medicare, and I want to keep it kind of broad brush, don't want to get too far in the weeds, because I find sometimes you don't want to have too many details in your head. You can just really have that analysis paralysis thing and really not do yourself a lot of good. For most folks, this is for Medicare. So Medicare, most folks have worked 10 years or longer and have now qualified for Medicare Part A for $0 per month. Then Medicare Part B, it might be, and it changes every year, let's say it's $174 a month. So Medicare Part B, you have to purchase Medicare Part B if you want to have anything else, like a supplement, Medicare Advantage, or a Part D drug plan. So the Medicare for Part A, if you've worked 10 years or longer, they call it 40 calendar quarters. Let's just call it 10 years. If you've worked for 10 years and paid into Medicare, then you can get the Medicare Part A at $0 per month. Once you decide I want to plug some gaps in Medicare, because Medicare, it'll pay 80% of your hospital bills, it won't pay the 20%. So that's what we want to cover. So if we're talking about the bills that Medicare doesn't pay, you don't want to have a heart attack or cancer and then you get hit with 20% of the hospital bill, okay? So the reason why we might want to have a Medicare supplement or Medicare Advantage is to take care of that risk right there. So to have a Medicare supplement or Medicare Advantage to take care of this 20% of the risk here, you have to have Medicare Part B. So you have to say, I want Part B, I want to start paying $174 a month. A lot of folks think they have to file Social Security to get Medicare. Those are two different things. Social Security is for retirement income. Medicare is for medical care in retirement. So we want to take care of that 20% so we don't get whacked. So we have to pay the Part B, and it might be about $174. It changes every year. And then you can do a couple of different things. You could have a supplement. A supplement, this could be, this is offered through different insurance companies, and they cover the 20% that Medicare doesn't. Or if you don't want the supplement, though, it could be all over the place. You could pay $200 a month. You could pay $400 a month, and it's going to vary by insurance company. So supplements can be expensive, but they cover the 20% of hospital stays, that sort of thing that Medicare doesn't cover. Or what a lot of folks are doing, instead of getting a supplement, they're getting what's called Part C, which is Medicare Advantage. There's pros and cons to all of this. When folks want to just keep their premiums low, Medicare Part C can be, in many cases, $0 per month. And it can help fill that 20% that original Medicare, this is original Medicare, doesn't cover. Medicare Part C, though, you're going to have to work within a provider network. You may need referrals for things. You might have a little $5 copay here and there. So why is the premium $0 per month? The federal taxpayer is paying some premium to one of the Medicare Advantage companies. It could be United Healthcare. It could be Humana. No, there's a whole ton of them. It could be Blue Cross, whatever. So that's the Medicare Part C. So to have Medicare Part C or supplement, it's an or. You have to pay the Medicare Part B premium. Now, you're also, once you're on Medicare, you are required to have a Medicare Part D drug card. Many times you can get that drug card for $0 per month because sometimes the Medicare Advantage comes with the drug card. So you could have zeros here. So you could pay Part B for maybe $174 a month, depending on the year, and then you could have the Medicare Part C for $0 per month, and then the drug card for $0 per month. You really want to have a drug card even if you don't use any prescription drugs currently, because if, say, 10 years down the way, you need an expensive prescription, you go and get a drug card then they could assess you a penalty monthly for the rest of your life for having gone some time without a Part D drug card. If you're over 65 and you're still working, you can stay on your employer plan, and if it's what they call creditable coverage, meaning it's similar to Medicare, that employer plan usually is very similar to Medicare as far as its benefits. It has a prescription benefit and all these things. Then they say, okay, you had creditable coverage with your employer, so when you go on Medicare at 66, 67, when you leave employment, there's no penalties for late enrollment. So don't worry about all that. So that's about the Medicare. Let's talk a little bit about the long-term care concerns. So long-term care, many folks never need it. I had somebody the other day, they said, well, what if end of my life I go into hospice for 2 weeks at home? Hospice it sounds odd, but dying at home through hospice, extremely affordable. Not that anybody's aiming for that as their goal, but a lot of people never use long-term care. Some folks do use it, maybe due to Alzheimer's or something, but it's not everybody needs it and you don't know. Long-term care insurance, hard to qualify for. If you're already ill, you may not qualify for it. We have clients that have heart conditions, hard to qualify for long-term care insurance. Clients that have multiple sclerosis, easy for you to say, hard to qualify for long-term care. So you have a history of cancer, different things can make it hard to qualify for long-term care. If you've experienced any dementia, hard to qualify for long-term care insurance. So the way long-term care insurance is underwritten, it's sort of underwritten, it's some kind of weird combination. If you can imagine a life insurance policy and a disability policy, lots of underwriting, health underwriting and all this sort of thing, and then expensive premiums. So a lot of folks don't want to pay for long-term care insurance. There are other ways. Maybe you save $5 million for retirement, and we can figure out that we can make some maneuvers to where we don't have a financial concern for long-term care costs. Maybe you haven't saved $5 million, and there could be forms of life insurance. There's certain life insurance policies, and I can't recommend, there's pros, cons to this. We have to talk about your specific situation. So down in the description, there's a link there for us to schedule phone time together. We can walk through this. But sometimes they have long-term care, they have life insurance that has a long-term care rider. Okay? Now, sometimes they have life insurance where there is no long-term care rider, but there's a pool of money that you can borrow from the policy, and loan proceeds are not taxable. So maybe you have a pool of money in a life insurance policy that you could borrow the money tax-free. It gets deducted from your death benefit, and so there's no money to repay. And then when you die, there's still a little bit of death benefit left that gets paid tax-free to your beneficiaries. So lots of different ways to deal with health care and retirement, to deal with long-term care and that. I'm not recommending you run out and buy life insurance. I'm not recommending that you give up your long-term care policy. I'm not recommending you do or don't buy a long-term care policy. We'll need to talk about it. There's a link down below in the description. You can click there and schedule free phone time with us. We can help you, like we just mentioned, about the under 65 health insurance. We can help you with the Medicare. Also, we can go through your numbers with you over the telephone or on a Zoom meeting or even in person, and we can figure out if you have enough money to get through retirement and still have your long-term care covered. And we can also help you with your ways to avoid the risk that you have with medical care in retirement. A lot of folks think that Medicare just pays for everything. As we talked about, it doesn't. They leave you on the hook for about 20% of a hospital stay. We don't want to see you get those sorts of bills in retirement. So this has been Retirement Dakota with Scott Tucker. I'm your host, Scott Tucker. I hope you enjoyed today's video, and we'll see you next time on Retirement Dakota.